take off your shoes for a moment. Not because your feet can diagnose diabetes, and not because every unusual sensation means something serious, but after age 60, your feet may reveal changes in circulation, nerve function, skin health, or mobility that deserve more attention than most people give them. So place both feet where you can see them clearly. Look at the skin, notice the color, move your toes, compare the temperature of one foot with the other. Ask yourself whether you have been ignoring tingling, burning, swelling, cracks, or a small sore that seems unusually slow to heal. These changes do not automatically mean you have diabetes. They can also be linked to footwear, aging skin, vitamin deficiencies, thyroid problems, medication effects, circulation disorders, nerve compression, or other medical conditions. But they should not always be dismissed as just getting older. Today, we are going to examine 9-foot changes that adults over 60 should discuss with a healthcare professional, especially when they are persistent, worsening, appearing on both feet, or occurring alongside increased thirst, frequent urination, unexplained fatigue, blurred vision, or a family history of type 2 diabetes. This video is for general education, it cannot diagnose you, and it should never replace a physical examination or a blood test. Before we begin, there are several situations in which you should not wait for a routine appointment. Seek prompt medical care if you have an open wound that is deep, infected, producing discharge, developing a bad odor, or surrounded by spreading redness. The same applies if part of the foot becomes dark, blue, extremely pale, or suddenly cold. Sudden swelling in only one leg, especially with pain, warmth, redness, chest discomfort, or difficulty breathing, also requires urgent medical evaluation. And if you suddenly lose strength or sensation in one side of your body, call emergency services immediately. For gradual changes that have been developing over weeks or months, continue watching. The purpose is not to frighten you. It is to help you notice patterns before a preventable problem becomes harder to manage. Script 14, Sign 1, Tingling or numbness, without an obvious reason. Almost everyone has experienced a foot falling asleep after sitting awkwardly or placing pressure on a nerve. That sensation usually improves after changing position and moving around. What deserves attention is a different pattern. You may feel pins and needles while sitting normally. Your toes may feel partially numb when you wake up. You may notice that the floor feels less distinct beneath one foot, or that both feet feel as though you are wearing thin socks even when you are barefoot. Persistent tingling or numbness may occur when peripheral nerves are irritated or damaged. Elevated blood glucose is one possible cause, but it is not the only one. Vitamin B12 deficiency, spinal problems, thyroid disorders, alcohol use, certain medications, and reduced circulation can produce similar symptoms. This is why guessing is a bad strategy. If the sensation keeps returning, affects both feet, disturbs your sleep, or gradually moves upward toward the ankles, arrange a medical evaluation. A clinician may check your glucose level, vitamin status, circulation, reflexes, and ability to sense pressure or vibration. In daily life, avoid walking barefoot if sensation is reduced. You may step on something sharp or develop a blister without realizing it. Wear comfortable shoes with enough room for the toes, and inspect the inside of the shoes before putting them on. Movement can also support circulation. A comfortable daily walk, adjusted to your mobility and medical condition, may help maintain blood flow and balance. Begin slowly if you have been inactive, and speak with your healthcare provider before starting strenuous exercise. Script 23, Sign 2, Burning sensations, especially at night. Some older adults describe their feet as hot, burning, stinging, or painfully sensitive when they get into bed. The skin may feel normal to the touch, but the nervous system is sending a sensation of heat or pain. In other cases, the discomfort may result from inflammation, skin infection, nutritional deficiency, medication effects, or pressure on a nerve. Do not assume that burning feet are simply caused by age or a long day of standing. Pay attention to when the sensation occurs. Is it worse at night? Does the bedsheet feel unusually painful against your toes? Is the burning present in both feet? Does it come with numbness or reduced balance? These details help a healthcare professional identify the likely cause. Avoid placing very hot water bottles, heating pads, or electric blankets directly against feet with reduced sensation. If your nerves are not accurately detecting temperature, you could suffer a burn without noticing it immediately. A stable eating pattern may also support glucose management. Instead of relying heavily on sweet drinks, pastries, or refined snacks, build meals around vegetables, adequate protein, and fiber-rich foods that are appropriate for your medical needs.